This is how much fentanyl it would take to cause a deadly overdose. On the left, just 2 milligrams. On the right, zero point zero 0.02 milligrams of carfentanil, just as deadly and only the size of a couple of grains of salt.
The epidemic of opioids, in particular fentanyl. As I mentioned before, fentanyl was a drug that has been used in the past as an anesthetic and pain coming out of surgery. It carries incredible amount of benefits when you're controlled environment. It provides pain relief, it provides analgesia, and it also provides some form of anesthesia. However, people have begun to exploit these benefits as a way to escape from reality. I always go back to the foundation of addiction. People become addicted because they taste this. People who suffer from illnesses as a young age, like for example, if you've been traumatized, if you suffered anxiety and you've never been treated, people can walk every day with these symptoms. And they discover the addiction through these medications accidentally. For example, let us say all your life you suffered with anxiety, but you don't know what that means, and you suffer from worrying, and you suffer from other stuff, and then you go to the dentist's office and you get one pain pill, and suddenly you provide relief. This is not the way to treat your condition. So let me talk about fentanyl. So fentanyl has become one of those drugs that not only kills your anxiety, it kills your depression, but it also kills you. And this is not the right way to treat. So I'm giving some advice about what's happening now in the streets. Somehow, carfentanil seemed to have entered our society. Don't know how, but it's highly potent. It is so potent that if you touch it and absorb it, it can actually cause you to become sedated without even you putting it in your mouth. It is used to kill elephants or sedate elephants when they're aggressive and you have to do. Now think about this. Who would want to put an elephant tranquilizer in your system? However, many people who are desperate with pain and they don't know exactly what to do become desperate and to make desperate decisions. This is why we're seeing now this increase of death. I already know from working at the hospital, I ask all my patients their life stories. I'm telling you, it's really crazy. People with fentanyl have this sensation of bugs crawling in their skin, and you can tell they're using because they start picking and scratching, and they don't look human anymore. Another thing I've learned, when they come out of jail, they tell me the stories, the horror stories. They see their friends die. Now try to visualize this scenario. Where do they do this though? In the days of old, back in the 20s, there used to be these opium dens, and what they used to do, they used to smoke opium, and basically to the point of sedation, and there were also death. So where do people go for these things? You've probably seen some videos online. I'm not going to tell the state, but I'm going to show you some samples of what happens when you take fentanyl. People are in the streets, they're drooling, they don't look human. They almost look like zombies. But let me tell you something. You can benefit by getting treatment. And this is what I want to give you hope. One of the things I advise all family members, it doesn't matter who you are, and if you suspect somebody is using opioids, you need to get yourself naloxone. There's an injection, you can get this now at pharmacy, and you may save somebody's life. Let us say you find somebody unconscious and drooling. Injecting the person, and even if they're not using opioids, right? You're not going to kill them. You're just basically going to give them a medication that can help them. If they're using opioids, they will live. How do we treat this condition? Okay. We treat this condition in many ways. It could be done in the office, and it could be done daily. It also could be done in the hospital. The beautiful part about this treatment, that it can save your life. But like I said, you have to be evaluated with the right professional. You have to be evaluated with somebody who specializes in the mental health field. In particular, you have to be very biased to psychiatry, because that's all we did. I will say that there are family practitioners that are now doing opioid detoxes, but it's very risky. Your best bet is to get help through a psychiatric care or a hospital that specializes in this. And there's hope. And the medication for this is called Suboxone. You know, we're living in perilous times. It's very sad. The enemy is not from without. The enemy is right here in this country. Ask yourself, why do we Americans, why does the United States become the biggest consumer of drugs in the world. I mean, we have everything, but yet we're the ones that consume all the cocaine. We're the ones that consume all the heroin, all the fentanyl. If you look at countries that produce this, you're going to be shocked. They don't have the same problems as we do. So I've always said, we don't have to be bombed to be destroyed. We're slowly being killed. And we make these choices. It's sad to see communities in the Midwest. I mean, you've seen the news. Police stations overwhelmed with families and children, teenagers dying. What's happening to us? Why do we do this to ourselves? I believe we have not learned how to tolerate with pain. I'm not just telling you about physical pain, emotional pain. The people who are addicted to fentanyl and all these drugs do have physical pain, but there are options to treat this pain. I believe that we have to be more lenient. Doctors have to be more flexible because there are very strict rules right now when you get pain management. Because the pain is so strong, sometimes patients will self-adjust to higher doses. And unfortunately, doctors are very scared and they fire the patients. And when you fire a patient, you do two things to that patient. They lose the hope and they give up. So what do? They can't go anywhere. They go to much stronger sources and they go to a drug dealer. Doctors, if you do pain management, make sure you do the right training and be more compassionate towards these people. Pain is not an easy thing to manage. You have to be flexible. I know you have to do these tests when you go to the office, like drug screens, because it gives you validity to continue their care. But look at the human side of these people who are suffering with pain. Before you fire a patient, doctor, before you fire that patient that you were basically educated, you were basically trained to treat, think of the consequences, what this patient will do. What are their options, doctor, right? They can't go anywhere else. You're the one that they can go to. You have to be flexible in treating these patients with pain because the ones I see at the hospital, they tell me that they had to do other options because the doctors were fired. You have to be reasonable and you have to understand. But again, it goes back to the same premise. The other people who use painkillers, they're trying to escape a sad reality. We no longer know how to deal with emotional pain. We now have to deal by escaping. We resort to alcohol. We resort to cocaine to give us mood. We have become a psychotropic. We have become a country that now has become obsessed with escaping pain. Next year, a whole group of psychedelics drugs are coming out. Yes, I have mixed feelings because I don't have all the data. LSD is coming back into the market as a treatment. Certain psychedelic drugs that stimulate your brain, but I don't have the data to make any judgment yet. I have mixed feelings as a psychiatrist because my area of specialty is addiction. The big addiction right now is now fentanyl. And as you know in my previous video, another big problem that's evolving is cannabis. I am seeing a lot of kids with schizophrenia in the hospital. Young kids, started at 17, losing their lives. You question yourself, why are we so dependent on drugs? What's happened to us? This is why we have to reevaluate ourselves, that it's okay to fail. It is okay to feel pain. Not everything has to be medicated. Relationships fail. Jobs fail. You know, failure is an opportunity to rebuild yourself. And one of the things I see with addictions, people feel like failures. They feel like they failed in relationships. They want to escape. You know, let me give you something about failure. You know, failure is like diving off a cruise ship deep into the dark ocean, not knowing where that ship is going. You left all alone, diving deeper into the ocean, and suddenly you have a choice whether to live or die. But somehow the will inside of you chooses to live, and you look up and you see light and you see breath. Failure is something that we have to accept as human beings so we can grow into better people. It is in failure that we become better people. It is in failure that we improve ourselves. It is in failure that we learn not to make the same mistakes. However, we have lost that. We have lost to tell our children that it's okay to fail. And I believe that there's a strong drive to push children to succeed in this country. And they will succeed, and these children cannot handle this pressure. Failure is okay. And the reason I tell you this, because this is one of the problems I see with addicts. They need something to escape. And I believe this is part of the problems that we have in this country with addiction. We don't know how to say no. We don't tolerate failure. We want an easy way out. Please consider what you're doing, because the death that we're experiencing in this country is now approaching 100,000 people a year. 1 in 6 homes and where you live most likely is addicted. We don't need to live like this. So once again, think of what I tell you. I will bring more future episodes on these and other issues. So like and subscribe. And as always, you're welcome to come to my office for an evaluation. And I'll see you next time in the next show.